Hello friends, I'm Dr. Rosa Olyai, obstetrician and gynecologist. In this episode of pregnancy and pre-pregnancy, I would like to share with you the important points which you should consider before getting pregnant, and once you get pregnant for the first 3 months, what needs to be done. So while you are planning for pregnancy, I'm sure you must have visited your gynecologist. So in short, you need to be aware of certain facts before getting pregnant. Because pregnancy is a beautiful journey, but you need to be careful and be well prepared. So, 3 months prior to getting pregnant, you need to start taking certain medications like folic acid. The reason why we take folic acid is to give you a better quality of egg. So, whatever you do before 3 months, like for example, there are certain medications that you were taking, or perhaps you were on certain treatment which needs to be stopped before you getting pregnant. Usually, we tell the patient stop it 3 months before you get pregnant. I'm sure you must be knowing your level of hemoglobin, your iron, anemic state of your body, your blood grouping and RH, and your diabetic level. So for all these, you need to do certain blood tests. So you should be absolutely fine. Your BMI in particular, your weight should be an ideal weight before you get pregnant, because sometimes with obesity and high BMI, you may land up in abortion. Now, for example, for 3 months you've taken folic acid, absolutely fine, your weight is okay, psychologically you're well prepared, you're happy, and you know when you're ovulating. So basically, during the 14th day of a cycle, if your cycle is a 28-day cycle, you ovulate. And you have been having a sexual contact with your husband and you have conceived. You walked in with a urine pregnancy test positive. So now you have entered the stage of pregnancy, the first month of pregnancy. We calculate the days, the date from the first day of your last menstrual period. So once you get your pregnancy test done, which is positive, either you do it at home or you come with your gynecologist, we need to get a dating scan. So the first level ultrasound scan, which is very important, is called dating scan, which is usually done at the 7 weeks. Most often, I see patients saying that, my mother-in-law, somebody said that, no, you wait till 3 months, you're pregnant. On the fourth month, go to the doctor, which is wrong. Because this ultrasound, which is done at 8 weeks, 7 to 8 weeks, is very important to see the cardiac activity, to see the heartbeat of the baby. The first 3 months is a period of organogenesis where the organs are developed. So you have to be very careful into not to take any medications beside your folic acid and what your gynecologist will tell you. Importantly, during this period, at the 12th week of pregnancy, that's your third month, you need to do another ultrasound. Your doctor will tell you to do a level 1 ultrasound, which is also called a nasal bone and an NT scan, the nuchal translucency scan, which talks about the measurement of the brain of the baby at the back of the nape of your neck, which is very important. Don't miss on this level 1 ultrasound. Most often patients say, why do we need to do ultrasound? It is not harmful. Rather, it gives you a lot of understanding about how the growth of the baby is. So during this period of time, you need to eat healthy food, walk. You don't have to have bed rest until and unless there is bleeding or any other issues. You need to get your blood pressure checked from time to time. And certain tests are done during this period, which your gynecologist will tell you. Keep a record of your whatever you eat, so the calorie content should be checked, because usually you have a lot of nausea and vomiting. It is safe to have medicines for vomiting, so don't panic about it. You should enjoy your pregnancy. This is a beautiful period of life which comes not often, so you have to be happy, you have to be prepared for it. Keep your medications in hand. Try to be on time for your regular checkups. Do not miss your doctor's appointment. In the next video, I'll be talking about the next stage of pregnancy, which is the second trimester. Stay tuned.